We do have those that are available to us. 11 utilities, 7 of them are assigned vector. We have two that are assigned to maintenance. We have our former ambulance and we have the mental bus. We have a work order and people and all our functional and as of today. Now, one of our responsibilities is to monitor shelters. And to monitor shelters with surveillance to prevent diseases and also through the environmental health officers to ensure that the facilities are clean and safe, and so those persons who seek shelter are not unduly exposed to any additional conflicts. Now, as healthcare workers, we should expect
Conference will now be recorded.
To monitor shelter. So medical assistants, nurse practitioners, the SCHD nurses, once there is a problem and we have a shelter where we have lots of persons, then we should expect that we are going to ask go in and do some monitoring to prevent diseases. So early detection and to support persons with acute or chronic diseases. We have done our inspections of the priority shelters. We've inspected 56 in Spanish Town, Pearl Harbor, and Linstead. 40 satisfactory, 16 were on, but we are working, the Parish Municipal Corporation are working to bring the others up. Well, as far as we are able to come to satisfactory standards. In Baltimore, there are 15 of vacant shelters that we have inspected. There are 3 that we are not recommending. And that's because we can use non-functional toilets and so on, but we have assurance that from the municipal corporation that they will try to do some work there. Now, it is important that the shelters provide that safe space for persons who seek to go there. Whether for whatever reason from their homes, and it is not acceptable, and we are trying to be very careful not to put them in a space where they will be further compromised. They're already outside of their home with all of the attending challenges there. In terms of communications, we have COGs in most, not all of the health centers. They only have 2 health centers with landlines, and we have credits. Yes, phone credits, for us to continue our work if it becomes necessary. The health department has a tool ready for what we are supposed to be training or outfits from outfit training as the use of the I think that is scheduled in the next month. Environmental surveillance will start after the weather event, and of course that will look at things like food safety, water quality, wastewater shelters, etc. We do have a disaster mental health response plan, and so the whole purpose of that plan now is to really assess the psychological impact on the citizens based on the magnitude of the event, and to ensure that we do provide that support and we continue to manage those persons with pre-existing mentally ill pre-existing mental conditions. Now, how do we operate during before and after an event? Staff, we have to understand that it is our responsibility to ensure that we are able to provide support for and that is for support for persons who may be affected by the virus. And as such, our networking has to be critical. So we are going to expect persons to report influx from our health centers and our health districts where there are challenges. We do have a WhatsApp group for disaster, and this WhatsApp group very active during the disaster, and we expect that the zones and the health centers, once you are part of that group, need to let us know what is going on. Please expect that you may be deployed to other facilities. Please expect that you may be asked to come into the health department to assist if for some reason we do not have adequate funds. Expect that we're going to call to find out about the number of persons who are attending the facility. Expect that if we do have injuries, the health center should be prepared to deal with. Do we have supplies to deal with trauma? Do we have supplies to deal with persons who, for whatever reason, may not have their medications? To deal with persons who, for whatever reason, may not have. We take things for granted until something happens because we always say it's not going to happen. I think we need to take a different approach and it's going to happen and just hope that it doesn't. Our responsibility is clear. We look after our homes, make sure our family and homes are safe, and then we ensure that we are able to provide service, health service to persons. Now, Spanish Town Hospital, Lakeside Hospital, as I said, we also provide service and assist as much as we are able to, or as much as they need us to provide assistance. And so we want the hospitals to be assured that if for some reason you need support in terms of medical support, we are here. If for whatever reason you are inundated with casualties, our St. Jacob Park Health Center is your premier. And so you can ask us to activate that to provide coverage. Same with the State Hospital, calling us to provide that service. I think that is it. Let us hope that the season is gracious to us. And if it is not gracious, let us hope that we are familiar and well versed in what we have to do, and that we are able to escalate our plans depending on what the system is. Thank you very much.
Thank you very much, Dr. Do we have any question for Dr. Chen? Are we saying that we don't have any question for Dr. Chen? We are also back on YouTube. So I have a question. I need to hear someone online and find a present for that person who can tell me what their assignment is between who have a disaster. Based on the roster that Dr. Chen got developed, need one person to tell me what their assignment. Dr. Chen, something don't sound right.
I don't responding, sir. Because they don't. Are you hearing out there? Hello?
Anyone hearing us?
Reposted.
Yes.
I'm hearing you.
Yes. Yes, hearing.
Yes, we're hearing.
Read.
The mental health. I see a question about psychological first aid from Dr. Michelle Henry. Yes, doctor?
So the question is National Mental Health Plan. Does that mean the mental health team may be called in to perform psychological first aid?
Yes, the plan was actually developed by the regional psychiatrist, and a part of that plan is for psychological person.
Okay, Dr. Henry.
Yes, hearing.
We can't hear them.
Yes, I was hearing. Thank you very much.
Any other questions? Any other? Have any comments?
Not hearing anything.
So this is what we were asking how do we join on to the latest course in the class. So you're able to utilize that now. So that means to make that join.
Okay.
Any other question? No other question. Okay, Dr. Chen, we want to say thanks to you for your presentation. You have something.
I was going to say that I would like to answer the questions. I can get the gift.
You are no one in this room is qualified to answer the question that and just to update to our online. In the room we have persons here. So we have Miss Bolden from HR, we have CEO from Spanish Town, we have Miss Angus, the expert on my HR who you're here from Charlotte. We have from Lynn, CEO from Spanish Town. We have Miss Lois, HR manager at Spanish Town. We have Lindsay, CEO, acting CEO, and of course we have just heard from Dr. Chen, and we also have Miss Ariel Williams. And we have Miss Chrissy, who is doing a lot of fabulous work here today. Did I say we have Miss Bowling? We have Miss Strong MIS support. We have Miss Lois and and Miss Sister Walters. And we have Miss Barrett. We have a strong team inside here to assist you. But at this time, I will turn over to Angus to do her presentation and my HR plug. By the way, which is now linked to money, so they're happy to hear.
Good morning, everyone. I'm not hiding. You can hear my voice, and that's so very important. That's the important information that you have to share. I may have lots of questions, so I'm here to support the HR team from St. Catherine's Hospital, and of course, Spanish Town Hospital on your transition to the My HR Plus platform for those who will be monthly paid, and any questions for those who are fortnightly paid that they might not be understanding how their basics might be looking, or even how to access the platform. So the most important thing for those who don't know, My HR Plus is an integrated HR and payroll software solution. What does that mean? It pretty much much means that in the prior way of how we used to be organized, if you want to get any information on ourselves, we'd have to find ourselves to our HR department. And because HR is so big and so far and widely dispersed for those who are in the health department, oftentimes they would have to leave their place of work or their station to access HR. You no longer have to do that because all the information you require is on your profile and you can connect with your HR department almost instantaneously. That is where we're going to go. Most important connection or access that we're giving you right now is what's known as the payslip feature or the payslip module. And that means you won't have persons who would have to access your payslip before you get it. Your payslip goes to your profile, you log in on a secured platform, only you have access to it. Pull on your pay information, and if you want to send it to NTE for loans or if you want to apply for a loan at midnight, you're not restricted because you need to get it stamped or anything like that. You download the PDF, upload it onto the online application that you're doing, and you send it off to your financial institution. They do accept the payslips without it being stamped. So you don't have to worry about that because it does have a signature on it that their system will know is authentic or authenticated. So you want to see who is speaking, Miss Sasha Gay? No, Mr. Campbell. We're gonna turn on the camera. Thank you, Miss Saturday. We're gonna. Hi. We're here. So where was I? We were on the authentication of the payslips. So that's the most that's the first level of tiered access that you'll get. After that, we get to the leaf module, where persons, if you're not feeling quite so well, today you can log in through your phone, apply for your sick day or DL, and HR will note that your application has been received, and the system will auto-tabulate your leave balance for you. So you no longer have to say, boy, HR, what is my leave balance? What is my, and they say, soon come to you, soon come, and the soon come never comes. So because we understand that HR is innovative, we're changing what HR functions will be, and where we can automate things so HR can be more strategic in their planning for you. That's what we want to do, and that is one of the lead modules. So that's tier 2. The first tier is your payslip. So all fortnight pay stations would have been live with the payslip module for my HR Plus as at December 2024. And as at today, we would have gone live with 9 of our 14 monthly pay stations. 4 still to go live with Parish Hospital, St. Catherine Health Department, St. Thomas Health Department, some public hospital, and the Bustamante Hospital.
Quick question.
Yes. What about applying for a job? Yes. Thank you, Miss Reese. You get a token. You take her name. She's getting a present from my HR Plus. So you find Miss Josephine, this lady right here. She has a present for you. That's correct. You can apply for a job letter on my HR Plus, but that comes after we transition you with the payslip module. That is what's known as the self-service manager option, where a lot more of your day-to-day requests can be filtered through. So if you need a embassy letter, which I know is a process over the past year, because there's no process at the regional office. So it is kind of creating a barrier for how quickly you can access these letters that you actually need to do your personal business. So those will become available inside Taser. Yes. Thank you, Miss Gooden. You are? Oh, Dr. Gooden? Yeah. The Sarah email is currently down. And we are currently, we're working on it, right, Miss Louie? We're working on that. So you do require a Sarah email to access my HR Plus. So just give the ICT team additional time to bring you back up to operational access, right? Does my supervisor have to send my leave with the my HR plus? Oh, hi, my nurses. Good morning to this morning health department. What is that? That's all already? Oh, good morning. A special good morning to my nurses. I had a lovely chat with some of you from the ER department. Yes, you guys have special tokens for you for me. So how I know you guys structure your leave a little differently, and we're gonna talk about that in a perhaps group setting, Miss Jackie and Mr. Campbell, because your supervisor will have to have access to the platform to give you that tier level approval before it goes over to HR. There's a next question. Hi, Miss Danville. If you misplace your username and password, how do you go about getting it back? Okay, another great question. Can I share the link through, can you stream the link? My hrplus.gov.jm. I think that's important for them to see. So we're gonna have a link shared with you. I wish I could share. No, I can't share the screen. And I will take you through the process of resetting your password, resetting your username. My hrplus.gov.jm. I think that's important because oftentimes we don't know how simple the process is. myhrplus.gov.jm. Hold on one second, Peter. I'm going to show you how to do that, okay? And that was a great question. See, it's restricted. No, it's not sensitive for the website.
Okay.
Oh, do you want to do it here?
Yeah, that's right.
No, me and money to chat.
You said no, organizer.
I gave him already. I'm trying to find him. I can't find him. There's so many. So many persons out there. I can't find Mr. Campbell's name. Okay. Unmute and talk. Unmute and talk so I can find it, please.
Check.
Alright, fine. Alright?
These are some good questions, though.
Yes, you can present.
We are all your friends. You sound very quiet. Really? Huh? Okay.
Change management.
So you know,
Hi.
you know Miss Lewis.
Thank you. Oh no.
You know Dr. Chunk.
Yes, I do.
Person said I'm not hearing
I'm
anything.
working with you.
You know, and you know Miss Golden. Miss Golden is the parish HR person.
Someone said that you were answering a question from them, but then someone Peter gave that. Is what you asked?
Yeah, that's what we're starting on.
You ready to share? Ready to share? I'm seeing it over here going on. Okay, yes, it's coming.
You can go.
Alright, we apologize for that. So if you look on the screen, you're gonna see the My HR Plus Access platform. So if you look to the top right of the page, I have self-service. Okay, perfect. Self-service is right here, which is where you go to access your pay slips and all the joyful things I was telling you about. And you type in your username here, and we can play a little game. So I'm going to give you some instructions, and then come in, who gets it right after I'm done, they get the tokens. So I'm going to give you about 10 seconds to use a piece of paper and a pen. And everybody in here can participate. You can get tips as well. So your username for My HR Plus, you ready to go? It's too easy for you. They're all gonna play, even Miss Hewitt too. It's the first initial of your first name. So let's go. The first instruction, write down the first initial of your first name. It's the first initial of your middle name. So I know persons, Jamaicans tend to have 2 or 3 middle names. So the first name is the first initial of that first name. And then it's your full last name for those of us who are not yet married. If you are married, the system recognizes that you are married and you are no longer your father's child, and now you are your husband's wife or your, well, we don't take, no. So yes, no. You drop off daddy's name and you embrace your husband's name, and then it's the first 4 digits of your TRN. And this is where persons lose persons because they don't know their TRN. Yes, I see a nice thing. So you get 2 gifts because when you leave here today, you're gonna learn your TRN. So the first 4 digits of your TRN. And it's done this way because that username can't be replicated. If you notice, it has letters and numbers in there unique to you. So let's forget. Coming back to you, Peter, again, don't think that we forgot about you. We did not. So it's the first initial of your first name, first initial of the middle name, and your full last name for those of us unmarried. If you are married, it is not your maiden name, it's the full married name, and then the first 4 digits of your TRN. So I want to hold on to that piece of paper, and then we're going to come back to that. So that would be your username here. And then your password, if the Sarah email was up, they would send you a one-time access password, and you would just copy and paste it here, click enter, and you would have, the system would have preempted you to change the password again. And you would change it then to something that you would regularly remember. If you notice down here, you see activate your account. You can also click this area if you are a first time user and go through the process that we just did, because the instructions are actually there about how to create your username. It's right here. You see the first 4 steps I went through? First initial of your first name, first initial of your middle, your last name, plus the first 4 digits of your TRN. And they place examples there because we don't want to lose people through the process. Because it's a process of change, and Ms. Williams will get into greater detail with that. So you obviously need your Sarah email to access the portal. You must have a GOJ email. Or if you can't use Gmail, you can't use Hotmail, you can't use Live. And I see quite a few persons from Spanish Town Hospital with some very unique emails emailing me asking for their username. And I can't assist without you emailing me from Sarah email. That's because I won't know who is truly an employee of Sarah. So I tend to ask them a series of questions. What's your full name? What's your TRN? So that I can verify that your information is on My HR Plus. and if you have connected with MIS or your HR department. Because when you send me an email from hotboy215 at Gmail, I'm not sure. You say I want my HR plus I missed a little bit.
Finalize goes to
Miss Jackie, Miss Jackie, love me. Miss
finalize.
Jackie.
Just give me race. One I race okay.
This is not such so Miss Jackie was the first person in the room who didn't have everybody with it too. So let's go back to the important question. Remember, that will answer is important. So her question was, right, he has access, right, the password, the date, receiver email, I mean the password, I should really want to call it, and you click the link, and the link into your email with the new information. So, Miss Danville, I hope that answers your question. I'm trying to scroll down to IT. Your mouse is in IT very well. No, no, no. Okay. I want to see, I can't move or want to see the next question is. That's it. Alright, so good morning. What about the ones who have not received their email? That is a great question. We just talked about that man that emailed me from Spanish Town Hospital. I hope people listening. I want you to go to your HR department, or you can connect with any one of your lovely MIS technicians or Miss Hewitt. It's important that you start the process by knowing what your Sarah email is. And unfortunately, I don't produce Sarah emails. So HR can assist, or your IT department can assist with that option, or the IT has a lovely WhatsApp desk. Miss Hewitt, do you know the number? Oh, she's gonna place that information in the group, in the chat. They do a quick response time to give you your Sarah email, and once you log in, you can send me an email from that, and then I will be able to kind of guide you further in the process. Very good question. So Miss Joseph said that a link was sent out, and that is true. And it is my understanding. I went to one of the locations, I think it was Wednesday, where I sat with an employee who showed me that the link was not working. So I know that our IT department is inundated at this time. So we will have that link reported so that we can have it working again. We would have spoken about it in the past, but as you can see there, the hands are full right now. So, okay. I'm sorry, what was the question? Okay. My email address? Oh, Sarah, email is down. Anika, ANEIKA at sarah.gov.jm. No, ANEIKA at Sarah. Right. So Miss Pearson, I heard that you would have tried the link. So just try the WhatsApp line, and I think the information is down there. Thank you very much to the meetings for putting the YouTube link. You can also drop the YouTube link for the payslip so that persons can learn about how their payslip is going to change it on the YouTube channel as well. Does my supervisor have to sign for my? Oh, we answered that question. Okay, great question, Dr. Antoinette. She's seen. Oh. No. MD. Oh, I am seeing incorrect information on my HR Plus and your public health inspector when you say be corrected. That's a great question. Mr. Seeking, reach out to your HR directly. So the good thing about my HR Plus is that when you access the platform, when you overcome that initial obstacle, you see everything about yourself over the past few years if you've been here a long time, and you'll see how you would have transitioned through the system from new hire to your current employment placement. If you see information on there that doesn't quite add up, you can either send an email to your HR manager, or you can send an email to myself. We'll find a way to have the correct data reflected, because we want you to feel at ease with using the system, and nobody wants incorrect information about themselves. So we're gonna have the address, Miss Antoinette. Also, do we expect Spanish Town monthly people to be added to the platform? That's a great question, Penny Smith. So there's a process for go live. We would have just concluded the process for Kingston and St. Andrew Health Department this morning at 1 a.m. So once your HR departments do what is required of them, then we can come in and push them through the final leg of the process. But we hope that they will complete that process by September the latest. We're aiming to have health department on for August. Right, Mr. Siki?
Yes, August.
And I see where she has no outstanding work for me where that's concerned, and we're gonna get her through the finish line for August. So we will keep working. Not hearing. Yes, Miss Jackie.
When I look at the banking information, has the correct account number, but it has incorrect.
We need to have that change. So can I move this, or do you want to hear? Okay, so I love your CEO. I love your CEO. She's very transparent. Thank you, Miss Jacqueline Ellis. So she pointed out she's on her profile looking through, because we went through the login process, and she's seen some incorrect banking information for herself. Her account number is fine, but the branch number is wrong. This is where she's not completed that process of the banking verification. So I have sent that out for some time, and I'm waiting for the verification process to come back to me so that we can change whatever needs to change within the system. But she's attached to, so when the HR does that lead, we can have the corrections done. But this is why it's important for you to log in and look at your profile. I see Huey looking at hers too, and I like that. Well, Mr. I can't make you look at yours. So we want you to log in today, like one here today. I guess today would be the day to ask all those questions. All right. Let me. It's all up there. First initial. All right. I'm scrolling through the comment section, so please give me a second. Okay, Carol Perry, my email is there. Sophie, okay, we have no more questions. So the Sarah email, my nurses, please, I know that you're eager. The Sarah email is done at this time. So please try not to rush the process. But I do see that, you see that 876 number 548-3603? That is the MIS help desk. And I'm telling you, we have a dedicated team of CSAs, customer care, but they know how to help you to get you the information that you need. So you can WhatsApp them, and they give you a response, I believe, within 24 hours. And they will get you in the direction that you need to go. So utilize the WhatsApp number if you can't connect directly with HR, and that is strictly for MIS issues. Yes, it's a help desk. I'm being corrected. I'm sorry. It's for help desk issues for emails only. So if you have access to your email, or if you have issues accessing your email, WhatsApp 548-3603. All right. So we would have gone back through how to access my HR Plus, what it is, the questions surrounding it, and the most important questions that persons have right now is when we're going to go live, and we would have addressed Spanish Town's concern and health department's concern. For the individuals who are hearing me, we just want you to, if you would have done maybe an upgrade of your education over the past year, because I know some of us like to send ourselves to school. I love that for you. That is very, career improvement is important, but you have to share the information with your HR department. The reason why is Jackie
And the deductions.
we're going to talk about that
Because I have Jamaica HR Association.
Alright, so when you log into my HR Plus, please do not look at any accounting information. We are not running the payroll engine, we're migrating data. So the data has not been confirmed for accounting. So don't come to Mr. Campbell and Mr. Campbell and say a big dollar value there for and I never made that channel. No, don't do that, and please don't do that to Miss Jackie either, please. No. The information is in the process of being migrated, and it is not, we have not completed the validation process. After you go live, no. If you see something there, then please speak up. Okay, Miss Jackie. Alright. I was saying something very important to me to remind about the go live process. Alright, Carly, you say you're not hearing? Are you hearing now? So Daniel says I tried to activate my HR Plus account just now, but it says the activation of your account has failed. Okay. So remember, Daniel, your Sarah email is down. They send you a one-time password link to your Sarah email. You can't complete the activation process till you click the link that will be sent where? To your Sarah email. Thank you so very much. I can change it. So I want you to be.
Yes. What we realized is that some details like the.
I was waiting on you to answer, you know?
Yes, and you know it was coming.
I did.
Yes.
And I had answer too.
The details pertaining to extra hours work,
Good.
the amount of hours and the rates that you're being paid. So those information are not available.
Alright, so I did my investigation. And I'm so happy you're here. I smiled when I saw you this morning. So the acting CEO of Platinum. Miss Lorraine, English Prendergast, Mrs. Prendergast. She would have brought something to my attention on my visit to her facility. And we sat there for about 15 minutes and we identified a small error. And now I can tell you where that error came from. It has originated in how the information. So we need to have a little
This conference will now be recorded.
So that you get to see it in an aggregated, which is what you require and how it's costing. So with my HR Plus, we have two payslip modules, a simplified and a very detailed one. And detailed goes down to the granular level of how many time and a half hours you would have being paid for that month versus how many double time hours versus how many sessions at any of the facilities within Sarah, which are 14 versus sessions outside of Sarah. It's very detailed. But if we don't populate or receive that information in that populated format and we just receive extra hours work, it's gonna come out as extra hours work. So if you want the detailed information in that way, we must receive it in that way so that the employee can benefit from the additional information. Okay, so, and this is at Linston. Miss Claudine, you're at Linston?
Yes.
This might definitely be very progressive. No, we have to fix that, Miss Claudine. So write that down. We're writing that down, Miss Claudine. And we will have somebody connect with you directly. You should not have any gaps in your years of service at all.
From 1998.
From 1994 to 1998? Oh, you were at a different facility? Okay, wait. Let's pause. Miss Claudine, are the gaps in your years of service when you worked at a different facility? You can just put yes or no in the chat. And then I will explain to everyone here what they can expect if they are in a similar situation like yourself. We didn't talk about it one time, but you have to get the
Ms. Roberts said, what's that show? So I spoke with them.
Okay.
When I spoke with them again,
Alright.
that's 4 years.
That's a lot of information. So Miss Claudine's situation is not like, so Miss Claudine, we can fix yours within the next 5 days. So thank you for bringing it to our attention. But if you are like Miss Jackie, where you are an employee that will have transitioned to different facilities, it requires connecting with that local facility that you would have worked at to plug in the years of service. Because unfortunately, how things would have happened in the past is that when you transition to a new facility, they just send over a letter. Right, come in? So they don't have any historical data on you of your past time at that facility. That file stays there, and then they will transition to their storage facility after a period of time. Right, Mr. Campbell, you sound like you know the process well. So, Miss Jackie, we are gonna looking for you. I have to be at bus stop Monday, so yeah, we're going to find out what is going on. Any other questions from any person in the room or in the chat? Because I do want to hand over to the change management specialist person who seems excited. You know, gonna tell you all about the great things about pro-site change. Maybe I'm excited for her. Right. So we're wrapping up at the end, and I want to know persons who would have done their username. If this is now your time for you to win a nice bag, I'm gonna show you what the bag looks like, or a change management cup. We don't have the cup right now. We have the bag. No, Miss Jackie won the 2 days at the hotel already, so that's gone. I'm sorry, but that's the bag that you could win. So come, who remembered how to do their username? Quickly. Well, I mean, not in the.
I'd like to try.
Hello.
This is Riley Harrow. I'd like to try.
It's just as the last one I saw was not no responsibility.
Are you hearing me? Hello? Are you hearing me? Miss Angus?
Who's the person who
Something about something Scott.
Okay, they put by the hand.
If you want to win a nice bag or any my HR plus token, go ahead, Miss Scott.
Hello, are you hearing me?
Yes, okay, I'm here.
Yes.
So it's the first initial of your first name.
He's talking.
I am not.
Hello.
She can type it in the chat. Yeah, ma'am, because it's not like they can replicate it. First initial, middle initial, last name, first. Miss Nicole, no, Miss Nicole. It's I want you to do it properly. First initial of the first initial of the middle, full last name, then first 4 digits. Or Miss Claudine? No, because then person to, if you give them the instructions that way, you know, they're gonna type all of their middle names. Oh, they're not hearing?
I'm not. Yes.
Alright, so based on what I'm seeing in the chat, I think I will come back out here next time. Come here and we'll do a department walk around, okay? So that we can have persons familiar. Because we want when persons are helping others, they're helping others to the finish line. All of your HR managers are super users, right? Right, Miss Lewis? Change management. I don't know what change management means. You okay, Miss
Yeah, they're not. And when they tell others, you know, they're gonna tell others in that way, and it's the frustration.
We don't want that.
No, that's why I'm muted because they're hearing all of this.
What we have not stated.
Yes, you need to do that then.
We're not taking no.
And I'm gonna hand over to Miss Williams, who's gonna introduce us with the camera. You can go ahead.
Hi team, I guess we all get some update on my HR Plus. I noticed we had a lot of questions that we were digesting the presentation. But at this stage we want to turn over to Mrs. Carnell Williams, who will take us through change management. Mrs. Williams?
No.
Hold on.
No, the presentation is on your device, Mr. Campbell. Remember, it's only one. It's on the phone.
So if it's here,
Where's the thumb drive? Okay.
The thumb drive is supposed to be inside.
Sorry, I don't know what the presentation. Oh,
The thumb drive was probably.
She will look over there. She will see the presentation. It will pop up. Open the device. Open the thumb drive. Yes, it's supposed to. I'm sorry, we use one device because it's the one that you share.
Is that the file that person wants to present from?
She can tell you what she wants to do.
Yeah, see there? Yeah, that's what it's coming up on the screen. We see it. You see it?
Yeah, I'm seeing it on the screen.
There you go.
Am I visible?
No, the camera is not on. You can unmute now. They said we're not hearing anything.
All right. Good morning, everyone. My name is Cordell Williams, and I am the Change Management Specialist with the Health System Strengthening Program
And I'm sure many of you will be familiar with the HSSP program. And so today we want to talk to you, as Mr. Campbell has alluded to earlier, about generally more about the HSSP and some of the opportunities that you can anticipate for growth and how you can position yourself to take advantage of those opportunities. Right, so it was John Maxwell that once said, change is inevitable. I wonder if anybody can complete that quote for me today. Change is inevitable. Is there anybody online that can complete that quote? I do have a prize as well. It's not a hotel stay, but it's still a prize. How will I know the persons are responding? I can't see that right now. All right, so I'm going to depend on the IT team to tell me.
That's what one person posted.
Okay. All right. So we'll get down to it further, but change is upon us now. And as you may be aware, there's an international call for better coverage, better health coverage for all, or better access to health for all. And in Jamaica in particular, this is really important at this time based on the high level of non-communicable diseases which exists, among the persons in the Jamaican population. So half the Jamaican population is reported to be obese. Okay. Just a minute here, we're just doing some navigation. Right. So half the Jamaican population has been reported to suffer from obesity. 1 in 8 persons suffering from diabetes, 1 in 3 hypertensive. So this is putting a lot of pressure on our existing healthcare resources. And, there's also the challenge that we have in terms of limited access to healthcare in underserved areas. And, you would have seen in COVID, the inability for us to, we did pull it off through COVID, but what we're seeking to address is the sector resilience within the health sector, so that we can have a more robust healthcare system, better management, quality, efficiency, and equity. And you see us in the news literally every day. Another report, of some issues that will really put pressure on the system and put a really negative stamp on, the national competitiveness and the resilience and effectiveness of the healthcare system. And my background is in economic development, project management, change management. I remember working on the economic growth program in the office of the Prime Minister. And one of the things that came out very strongly in the lessons learned is that the healthcare system is not a standalone sector. It is very crucial to attract, investments. It's very crucial to attract tourism, which we rely on heavily as a nation. And it plays a significant role in terms of productivity. And we're suffering from that issue locally now. Productivity that can really enhance, our growth and development as a country. So it's not a small thing for us to address, the quality of life and the well-being of Jamaicans. It's very crucial right now that we put some emphasis on that. It's crucial that we look into addressing the overwhelm among the staff so that they're better able to deliver more effective health care. They are motivated, and so that we can have better room for reinvestment in workplace conditions and staff well-being, and just generally improving the national international competitiveness and well-being of our country. Okay, what's going on here? So what we're seeking to do through the health system strengthening program, I should have used the acronym there, but the health system strengthening program's focus is really to create a more modernized health sector that will address all the challenges that we are facing as a nation and position us to consistently improve the delivery of healthcare going forward, and with a strong emphasis on non-communicable diseases, because that is really the crux of the matter and the challenge, the greatest challenge before us. And so as part of the health system strengthening program, we have several components, 6 major components embedded there. So we're looking at rolling out policies that address non-communicable diseases. We have investments in infrastructure and tools. I remember going to a conference recently and persons saying, yes, we know there's infrastructure work going on because we see the cranes at the Spanish Town, which is indicative that we are doing some work at the Spanish Town Hospital. So, it's no secret that there's infrastructure going on. So the upgrade of 13 health facilities in underserved areas, which I mentioned before. There's purchase of equipment for these facilities to drive, greater accessibility to certain services, which I'll talk about later. There's partnerships that are continuously being strengthened with the Interdevelopment Bank and the EU to foster greater investments, research, and other technical assistance. There's a digital health ecosystem being rolled out. You would be familiar with the electronic health records platform. There's a telehealth, telemonitoring. So we're rolling out apps which will allow patients to have access to videos and information to better manage their diseases on their own. There is another app called the AirMed, where patients will be able to view a copy of their electronic record on their cell phone. So these are some of the things to come. There's SNOMED, which will heighten the effectiveness of the EHR system in terms of producing more accurate reports. So there's a whole entire digital ecosystem built around creating better management of NCDs and also just helping to strengthen our delivery of care in that area. And of course, we have modernized patient-centered chronic care model, which is centered again around management of the NCDs, right? So we're looking at driving this from a data-centered perspective. So we have the health and lifestyle survey that will look at how persons' behaviors are helping to perpetuate the instances of NCDs, and using this to further refine a greater and more efficient model of care. I mean, one of the things that persons will tell me on the ground is that the chronic care model is nothing new, right? We tailor our responses based on the challenges that people are having with managing their non-communicable disease, but with greater data from a health and lifestyle survey, we're able to better tailor the chronic care model, and we are basing the chronic care model, aligning it with more international standards and ensuring that it is consistent across the healthcare system. That will be the difference, really. Ensuring that, the management of it, that the teams are trained, and you would have seen some of the community health aides being trained in food care, right? So we want to make sure that the consistency in there in terms of processes, consistency in terms of the people and what they're expected to do, consistency in terms of, the services that are offered, and also ensuring that the necessary tools are in place. The necessary tools, the equipment are in place in the various health facilities that can help us to be more efficient in the management of the NCDs under a model and chronic care model that allows us to track the results and continuously improve going forward. So these are just some of the things under the health system strengthening program that we are looking to roll out, constantly roll out over time, and you have begun experiencing some of this change already. So there's much more to come. We're sharing with you what really is to come. And this is part of, it's not a standalone intervention, because many of you on the ground, you will know even more than me that this is part of the ministry's bigger transformation thrust, right? There are a myriad of other initiatives that are taking place even now that will align with the health system strengthening program and will help to bolster our ability to hit the ultimate target, which is to improve and strengthen how we deliver care. So you have the electronic immunization registry coming, National Cancer Registry, digital health platform, and a host of other initiatives and systems that are coming on the way. And how this is impacting, in particular, the St. Catherine Parish. For you, in particular, we are seeing the rollout of up to $10 million worth of health infrastructure right now. So there are changes in the St. Diego Health Center, Greater Portmore Health Center, Old Harbor Health Center, and not to mention the Spanish Town Hospital redevelopment. A myriad of services, for example, St. Diego, dentistry services, mental health care, more focus on that, diabetic retinopathy screening, laboratory diagnostics, etc. So as you can see here, a myriad of additional services will become available to persons living in and around that area. And in essence, what we are seeking to do, as you would have noticed, is to put a lot of emphasis on the health centers, because when we think of NCDs, we want to ensure that persons don't reach a chronic stage when they're ending up in the hospital, putting pressure on the infrastructure, and the resources of the hospital, right? So we want to ensure that primary care is strengthened as much as possible, and this is why a lot of emphasis is being placed on strengthening the health centers and ensuring that, the community health aides are equipped to do a lot of work in the community. Right? Some of the impact that we can expect, of course, greater healthcare access, which is the ultimate goal. So having the health centers means more accessible quality care closer to home, right? In terms of the local job opportunities now, as we are looking at construction, etc. So the opportunities will be there to bolster community resilience and well-being. Job creation is also important. So investments, just mentioned construction. Additionally, new professional pathways are emerging. Okay, health, IT, community-based care, and specialized diabetic foot care aids. Those are some of the new and emerging opportunities, and I'll speak even to more opportunities going forward. So some of the emerging careers and workforce development interventions, as we would have seen, 41 community health aides have been trained across Jamaica, across the 3 regions rather that we are impacting under the HSSP, right? But recently 17 of those would have come from St. Catherine, and they would have earned their their certification in foot care for diabetic patients. So this is again boosting the primary care access, the access in the communities, rather than persons having to come even to the health centers or ultimately to the hospitals. And of course, with the launch of the e-care, the electronic health record system, this is introducing the new roles, the digital healthcare, the data management, the IT support, and the system training for staff is just happening. So the ultimate point is that change is inevitable. right? Change is inevitable, change is happening all around us, not only with the HSSP, not only with all the strategic initiatives that we've listed before, but even in your own regular operational framework or spaces. I'm sure you're seeing other changes as well. The point though is all of this change that is happening, modernization that is happening, the growth that will come from it, the transformation that will come from it is entirely up to you. It's entirely up to us as individuals. One of the things that we recognize, I mean, I've worked as a project manager longer than I've been a change manager. To be honest, I have over 20 years, in the corporate space in both areas. And what we have seen is that, you roll out all of these systems, you roll out your processes, you roll out your policies, right? But there's a gap in terms of looking at people and how people are impacted by the changes that you're rolling out, and are people ready for the change, to embrace the change and to do what it takes in terms of collaboration, in terms of buying in terms of usage and adoption of the change for a sustainable time that will allow the company and the stakeholders or patients in this case to realize the benefits from the change, and even the people themselves, how do they access and tap into the benefits for themselves. There's a real gap in terms of yes, what's it?
Is there any staff or staff?
All right. So it's like I got a telepathy, right? So yes, I'm glad for the question. Right. Generally, Miss Angus has left, right?
I'm not sure.
She stepped out. Right. So of course, thanks for the question, and that is the point. There's the approach that we have been taking on the health system strengthening program is the people-centered approach to change, right? That's a PCI, people-centered implementation approach to change, and this is particularly important. So we're not using ProSci on this program, but a people-centered approach. And what this means is that what we have been looking at is what are the issues, the people issues, right? The people concerns in terms of the professional concerns, the operational concerns, right? The cultural concerns that would impact or prevent persons from buying in, collaborating, owning, adopting to the changes on the HSSP program, and in so doing, creating a strategy that will help to, impact and create the motivation and the collaboration that we need to roll out the different components of the program. And it's interesting because, one of the things that have been identified from the approach that we have used is that persons were able to switch their mindset from, looking at issues to looking at solutions, to, coming up with different strategies that can help, in particular, the EHR system, which was the first component that I came on when I came on to the program that we were focusing on. Because of the focus on the people and because of the issues that were raised, and I do have some of them that I will address further down in the presentation that you have raised across the three regions, near us, Southern and Sarah. Some of these issues that are even outside of the project, like I mentioned, the operational concerns that are even outside of the project that will impact the buy-in. Now, in terms of motivation and ongoing motivation of staff, I know that there are some that have been raised, some operational concerns outside of the scope of the project that we have highlighted and made, management aware of, and we will continue to collaborate on that as best as we can, because I don't know if persons understand the scope of a project that may not be within my remit to address some of the concerns, but certainly we have no noted some of them, and I'm looking forward to hearing from you as we do the presentation if there are any additional concerns that we can take into consideration as we really try to get the benefits realized from this, these transformational or modernization initiatives that we're doing. So let's go through the presentation, and when we come to the area of the issues that you're facing, certainly if there are additional issues that perhaps we haven't touched on, then you can be free to raise them. Who was the person that raised them?
The person that asked about that is a
Security nurse.
No name?
No, it's a group.
Oh, it's a group. Okay, so security. All right, so what we want to talk about today is that the move from modernization to transformation requires us to get into a growth mindset, right? So change is inevitable, change is happening all around us, but how do we seize the opportunities to grow, to gain the knowledge, to refine our skills, to optimize our performance, to widen our career prospects, and to really take advantage of all that is springing up before us? It's really changing the mindset, changing the perspective in terms of how we see the change happening around us. Now, one of the things that I normally share is even a personal story. Can go on. All right. Okay. Right. Thank you for that. Right. So I normally share a personal story when I talk to persons about change. I remember when I just started my business, right? Because I do have a consultancy company called Transformational Life Solutions, right? So it's a training, coaching, and consulting company with a great emphasis on project and change management. And I remember when I just left my job, my good corporate job, right? I went into the world of entrepreneurship. I went in bright-eyed and bushy-tailed. I would send out, all my briefs and my proposals on a daily basis, call up everybody I know, all of that thing. I remember one day I even sat and I did like 100, no joke, 100 calls. And I'm talking about, hi, I'm Cordell, and hung up the phone. I literally went in and spoke to people, shared what my business was doing and all of that. And let me tell you something, every single day, what would happen is I would make the calls and I wouldn't be getting any contracts, right? Nothing was happening, or so I thought, right? Nothing was happening, and by the end of the day, somebody cared about me very much, would call and say, what happened today, how things, right? And I would say, nothing happening, we do this, we do that, but nothing, right? And then the next day, I would go in and I would do the same thing. Somebody would call and I would say, nothing now go on, right? No, that was just happening every day, nothing. And I continued in that loop for some time, months even, until I watched this presentation on YouTube by Neville Goddard, which said, whatever you sow, right, you must reap, right? So all the proposals that I was sending out, everything that I was doing, that was me sowing, yes? But you cannot sow and reap at the same time. Right? You have to sow, and there's a season of sowing and there's a season of reaping, but you can't sow and reap at the same time, right? So the transformation and the growth that I was able to see didn't come until I shifted my mindset to say, when you look around you, right, you will see the cranes springing up, you'll see the EHR system, those things that we are touching, that we are seeing, that we're experiencing today, were seeds sown probably 10 years ago, 20 years ago. somebody had an idea and said, oh, you know, we need an electronic health record system. And somebody said, you know, what kind of foolishness that, oh, we're supposed to go electronic, right? Don't make any sense. But that person probably wrote a paper about it, submitted it to management. And them say, no, sir, we not do that. Them go back and them refine it, yes? And they come back with it until today. We're using an EHR system. Not perfect, right? But certainly there are plans similar to how that person continued to refine that proposal. Maybe there are plans to refine that. There's work, there's seeds being sown to get us to the stage that we ultimately want to be. So we're not where we need to be, but we're not where we used to be. And there are opportunities there to grow if we're willing to sow, right? And take advantage and keep our mindset in whatever we sow, we are going to reap. And I say that as a precursor to what I'm about to share. There are a myriad of opportunities for you to gain knowledge. There's opportunities for you to refine your skills, optimize your performance, and widen your career prospects. But right now, you know, the question that was asked, you know, we're demotivated. And let me tell you something, I'm on the ground and I hear the story, so I do understand. Yes? Why you're demotivated in some instances. However, I say this to say you're not where you need to be or where you would ultimately want to be. But it doesn't prevent you from sowing into the growth opportunities, the ground of growth that is springing up before us. Let us sow into that and see how much, you know, these opportunities can help to motivate us, can help to move us forward, and move us in the direction that we ultimately want to be. Okay? So I'm putting that out there, that our mentality, our approach as we go forward has to be about growth, has to be about sowing, has to be about embracing the season of sowing, has to be about solution, being solution oriented, having a solution mindset, you know, coming up with different strategies. Something is not working. For example, you just said, you know, there's demotivation. What will it take to motivate you? Right? How about writing maybe a strategy paper on 10 ways in which we as a staff, the nurse group, can be motivated, and send that to the CEO or Mr. Campbell, the parish manager, so that we can begin to see, you know, some changes there. All right? So gaining knowledge, great opportunities to gain knowledge are before you. So through the HSSP and all the different components of the HSSP. Of course, the patient-centered chronic care model is a global best practice approach. Now, I'm not telling anybody, certainly we are short of nurses and doctors and all of that, right? But guess what? The opportunity is there for you to align your skills and gain the knowledge that is used around the world. Right? You never know what kind of opportunity might spring up before you. You might get a scholarship to go somewhere and certainly come back to Jamaica, right? But you know, the opportunity is there to align globally. You're being introduced to it. You're going to be trained in it. Right now, there's a course I know that the CHAs are doing on the chronic care model. The same group that was trained on the foot care is now online doing a training in international chronic care model, how the chronic care model works. So that's an opportunity that would not have been available unless through, you know, the push that we are doing here now, right? So that's an opportunity to gain knowledge. The new clinical protocols for chronic care management, the digital health literacy. We're interacting with an electronic health record system that rivals global standards. In fact, the IDB was here, I think it was not June, probably early June. They did a tour of the different facilities, etc. And they created a report. And coming out of that, the gentleman that led the mission, the IDB mission, he said he has worked in the IDB for 20 years. And the rollout of the electronic health records system, the approach that we have taken, the strategies that the staff has done, and how the staff has worked with the project team, they have never seen it in 20 years. Right? And so we're, I don't know, little small dibby thing we're doing here, right? We're rivaling the region. The region is now looking to us. All the countries in the region are looking to us to see how we were able to pull this off and what are the plans in place to get it to an even greater stage. So we are making moves, and you're getting the opportunity to understand, how to code, how to use an electronic health records system in a health sector, a modern health sector approach. And so the mobile apps that I spoke to that are coming on board will even strengthen our delivery in that area and strengthen your knowledge in that area. Additionally, a lot of new equipment is being installed, modern equipment. Just yesterday, I believe there was a handover of some additional equipment in Nero to provide some of the additional services that we spoke about, or we will talk about in a short while. So there's opportunities to utilize, right, to get training in how to use some of these modern health equipment, and understanding and mining data for better patient outcomes will also become a part of your knowledge base at the end of the rollout of the HSSP program. Additionally, how your skills will be sharpened. So clinical and electronic documentation, reporting, and general health record management. The greater level of data analytics for decision making, both at the clinical and the operational levels. Quality improvement and evidence-based practice. I spoke earlier about we don't move without data. That's where we're getting to. Data-informed strategies, data-informed delivery of care. That is where we want to get to. So managing digital consultations, remote care, and better engagement via mobile health solutions and mobile apps. These are things that you will be able to take advantage of. Health coaching and behavior change techniques that are essential for chronic care management will also become areas of training. In fact, right now we are developing the chronic care curriculum for the staff. So some of these areas you will be trained in and you will be exposed to. So in terms of using data to tweak the patient's care strategies, all of these things will be addressed in the training that we are about to roll out. And I'll speak more about some of the actual training courses and programs that you can take advantage of later. There will be opportunities, of course, to optimize your performance. It can get boring when you're doing repetitive things, when you don't know, you don't have insight into why you're doing what you're doing, right? So with better data, a better data-centered approach in terms of how you deliver your care, that will help you to optimize your performance and focus more on what matters, right? So the digital patient records are helping to reduce errors and delays. The data dashboards will help you to spot patient needs earlier. And the team-based chronic care will improve your outcomes and work satisfaction. Okay? That's the ultimate goal that we are working to. And like I said, with a solution-oriented mindset, how do we close the gaps between where we are now and where we ultimately want to be? So some of the programs in terms of quality improvement, specialist training, clinical governance and risk management courses, digital health transformation workshops. These are some of the things that will become available to you. In fact, the conversation now is how do we work with the IDD, which has a number of training platforms to make courses more available to persons in the health system. It's a big conversation now as to how we can do that, right? Then there's the opportunity to widen the career prospects. I I know work is ongoing now. We just came out of a series of sustainability meetings where we are talking to the different regions about workforce planning. One of the questions that persons have asked is, hey, how you building up all of these buildings? Who going to work in the building, right? That's a concern that has been on the table from the get-go. And so workforce planning is something that the regions have heads up on, and there's a sustainability focus now. The focus right now is on sustainability. How do we make sure that we have maintenance planning? How do we ensure that we have the right policies, the standard operating procedures in place? How do we make sure that the people have been identified in terms of the workforce? How many nurses do we need? What are the additional careers that are springing up? And how will we close those gaps? These are real challenges, but they are not insurmountable, but challenges that create opportunities. So health information managers, health IT specialists, and remember now, the HSSP program has only been rolled out, or will only be rolled out in the first tranche within 13 facilities. There's discussions right now enrolling out across the island. So we are going to need people who can manage, so the health information manager, the health IT specialist, the chronic disease care coordinators, the health data analysts, the telehealth nurse or clinicians. There's so much opportunities, as you can see here, that will be springing up before you. And you will get more information about this once the workforce planning, and I'm sorry, Ms. Angus has left, right? Because HR will have to work collaboratively with us, yes, to talk about the workforce plan. So digital health policy analyst, healthcare facilities manager, because we're building up new buildings, right? Medical equipment maintenance technicians, hospital engineering technicians, safety and compliance officers, so many careers that are springing up before us even today, right? Glad Miss Angus is back, right? So what does that mean with so many opportunities, job prospects? And these are things that we will need, right? Not things that we may need, but things that we will need. What does this mean? Does it mean that we're going to hire all these additional people? Maybe not. Upskilling, enhancing your roles, right? What's that? Reskilling, expansion of roles, which you know what that means. I'm not going to close that. Right? Partnerships, right? News, all kinds of skilling, right? But the point is, we will need these skills within Sarah, within Jamaica, technically, right? And I say within Sarah, within Jamaica, because again, that means, of course, I don't want to take away your people now, but persons can work across, wherever they want to work, wherever they are needed. Once you have the skills, it's like you open up a whole new Jamaica to yourself, right? I don't want to say world because we need you here, right? So you're opening up so much opportunities for yourself. But what does this mean? It means that you have to position yourself to grow. And I've identified some of the training programs, and this is something that we have to work more with HR to actually identify the training programs, and where they don't exist, we may need to create an academy internally to develop these programs, because right now, as I said, we the HSSP, we are working on developing the chronic care curriculum. This is something that HR can be looking into. What other curriculums, if they don't exist in some of these institutions, that we need to be developing them quickly. And it also means that with the time constraint, because when I came on, one of the things person said, if we don't start doing the workforce plan yet, will we have the people in time? This is something that Partnership is going to be required. Decisions are going to have to be taken in terms of is it on the job learning, on the job training as people transition into these roles? These are certain discussions because you may need to train for 3 years. But do we have 3 years to the building? I think the latest timeline that we have is 2028, isn't it? 2028, right? So that's 3 years time. Some of these programs, how long are these programs, right? What decisions are we willing to take in terms of persons can get into the role with a certain amount of training, and after that, how much time do they have to complete the training, etc. There are conversations that we need to have and work collaboratively with HR, and I know that work is being done now under the sustainability plan, right? Which has kicked off in recent times to really put emphasis on that. It's not that work wasn't going on before, but really a coordinated, strong focus on that is now underway. So these are just some of the training programs available, and this is something that we can circulate through. What's that? We can circulate through the parish office to ensure that you have access to this information. Additionally, outside of the growth opportunities, right, we have brought up for you. Right, so this is an opportunity again for you to increase your collaboration and your professional network, and it's happening like never before in Southern, and I know it happens here because I've seen it in my own interaction with Sarah and Southern and Nera. People are working across facilities, they are working across regions, they are building those, they're sharing information, sharing strategies. One of the things that we do from a change management standpoint is that we have the change champion circle. And I've seen persons come online, to share their, you have persons like Marty McLeod, you have Miss Hines, no, there's a name, Lothan. Yes, how could I forget that? Sophia, I hope she's online, right? Sophia has come on, Lothan, to share what's working for them, the strategies that they have developed, and sharing that across regions. Because people in one region or in one facility might not be, moving as fast as the others, and we are able to come together and share. So it's an opportunity like never before for you to learn from each other, to build stronger, more collaborative teams, right? And let me tell you something. One of the things I've learned, network is your net worth, right? There are times that person that you work with on a small project, don't take the interaction lightly. That person, you don't know where they're going to end up. You don't know which position they're going to be in. You don't know what door they can open for you or what door you can open for them later on in your professional career. So it's really it's a growth opportunity. Again, you're learning from each other, but you're building stronger relationships that can help you to position and to move forward, right? So improving patient care by engaging with your colleagues in different roles. This is also an opportunity for you to cross-pollinate in terms of the knowledge that you have. Being exposed to the project, being trained in the different areas that we mentioned. You are learning so much more. Even though you're not an expert in it, you can become an apprentice in it because you're learning so much. So expansion of your professional network and creating those mentorship and leadership opportunities, it is just phenomenal what I am seeing and witnessing on the ground. Additionally, it's an opportunity to embrace a better work-life balance and enhance processes. So these digital tools, the EHR in particular, reducing, and the question, recently the question was asked, is it paperless or less paper, right? What's that? Is it, I will throw that out. Less paper for now, right? That's where, and certainly we're not where we want to be, right? But with the continued work of the HR team, with the continued work that you're doing, we're moving to paperless, but we're less paper. So the reduction in the paperwork, freeing the time for more meaningful patient care. We're seeing the CHAs getting the opportunity to do some of the, step up in terms of the work that they're doing, and that is helping the nurses, to have time for more meaningful patient care and more meaningful work. So the streamlined processes will decrease the stress over time, allowing for improved work-life balance, and allow us to use that time saved now to focus on the personal development that we need to focus on, which is the training and the taking of the courses to better position ourselves to move up and to move forward. So what I said before, change is inevitable. It's not like we can say, no, don't change that, stay right there, we're gonna stay fixed here. No, change is happening whether you like it or not, whether you're on board or not. But why not take the option to grow? Why not take the option to seize, to sow into the growth opportunities that are before you? And that is a message that we want to leave you with today. Change is inevitable. It's not something when you say now go, it's a home, right? It is sure, but why not take the opportunity to grow? And this is where change management comes in, to provide you with that support, to help you to seize these opportunities, to see the opportunity in the challenge, and to help you to seize the opportunities. And this is why, a people-centered approach is crucial. We have done a number of surveys to identify how change will impact you, to diagnose any kind of resistance that we have seen, to identify the legacy issues that you are struggling with. I know a number of you may have participated in those surveys, and this is what we have been doing, taking these surveys to understand what are the people concerns, what are the concerns that you have that will prevent you from embracing this change, participating and collaborating, and in essence being able to experience the benefits that we know are going to become available to you. So let me tell you some of what we have heard and how the change management is really working to support you. And if at the end of this you feel like there's still a gap, please feel free to share any other concerns that you have, because it's a part of the people-centered approach that is a responsive, proactive approach, right? So if there's anything else after I present some of the things that you have shared with me and how we are responding to it, if there's any additional issues, any other concerns that you want to bring to the fore, I'm excited to hear about them, okay? So one of the things that came out of your responses and what has been shared is the whole matter of change overwhelm. The over allocation, the amount of, the myriad of, change initiatives going on, the competing priorities, persons have felt like, we're overwhelmed with this change. And this is why we have the change champion circles, and this is why we have the intention to roll out the training of additional change agents to strengthen the change management capacity, within the health system, right across, not only the Sarah, but right across the regions. Some of you have expressed, slow learning curves. The slow learning curve for some team members. In some instances, it took persons some time, to get acclimatized to the EHR system, right? We have done transition support workshops with some regions. As I mentioned, we have the Change Champion Circle that we have rolled out where persons share their knowledge for specific issues that they may be struggling with. The support teams, you have your liaisons that you can talk to, and you have active change champions on the ground. Nurse Riley is one of them, Sophia Lothan is one of them, that just works with the team, identifying what are the issues. And we have the steering committee every other Monday where these issues come to the fore, and we respond to these issues. I know the EHR team also has an active YouTube channel where they share, the training is there for those who need to revisit it. We also have, excuse me, a change champions corner that we are developing in collaboration with JIS, which all of the change champion circles that we have had, all of the trainings that we have had relating to change management, are gonna be on within that link that you can access, you can watch, you can learn from, right? So that you can help to improve, your motivation is one thing, but the learning curve, any gaps that you have in your learning, that will be available to you in short order. Then there was a mention of limited laptops, persons mentioned limited cards for the devices, the tablets, in some instances, challenges there, internet connectivity, power supply issues. We know that the project has procured 100 laptops distributed, right, as well. Amen? Amen? Right? And I know that the region now is working to get some additional devices, cards, etc. Right? The sustainability gaps that we spoke about, the staffing, in terms of staffing, nurses, equipment maintenance, administrators, midwives, all the gaps. The workforce planning team now, the sustainability team is going to be working hands in glove to get those things addressed. So the policies, everything that will support not only the realization of the benefits, but the sustainability of this over time. And one of the things that was said to us in the data gathering is that projects come and projects go. Yeah, so we start a project and we see it for 2 months and then poof, it's nowhere to be seen. Yeah, people are off the system, they are back to their old ways. We are trying assiduously. This is why sustainability is such a big focus right now, to ensure that this program and its results are sustainable and that you can ensure that you, sorry about this, sorry about that, guys. I'm being real. There's a time for everything, and you know what's the time coming up, right? Anyway, let's get back to this now. So knowledge gaps. So the clarity, one of the issues that was raised as well is gaps in terms of clarity on the components of the program. What the program will and will not cover, what EHR will and will not cover, and what additional services are to be introduced with the advent of the new facilities. We have an Ask Me Anything session, and if you are not hearing about some of these things, you need to blame your change agents. Right? And we need, as we identify, we are going to be training more change agents. So we will have more people on the ground. And if you're still not satisfied with that, then you need to become an agent of change. And if you're interested in that, so that you can keep your pulse on what is happening, so that you know about these things, you can put your name and your number in the chat, so that you can be added to the change agent network. Okay, so we have Ask Me Anything sessions with the different program components. So we have had Ask Me Anything session with the EHR team, with the component one, which is the construction team, right? And we have had Ask Me Anything sessions with the chronic care model team. This is where you have any question that you have, you can ask and get the question answered. We have video collateral and other communication collateral. You would have seen the videos. I don't know if you have seen them on your screens, where we did interviews with the different project leads, answering questions that you have put to us, right? So that you can understand what this program is about, what the benefits are, what will redound to you, what's in it for you, type of a thing. And we have at least 4 more videos to roll out before the end of the quarter, right? We also have intention to mount some change corners in the different facilities. So things like the design of the the remodeling of the health centers and the Spanish Town facilities. We have intention to ensure that those are up and you have access to, different communique that answers some of your additional questions that you have. All right? There's a disengagement of some team members and the inability to attend training sessions due to competing priorities. We mentioned the YouTube videos, the Change Agent Network, and we do have a Change Champion competition coming up. Of course, procurement sometimes does delay the launch of some of these well-intended programs that we have. And I'll leave that for the end to talk about the Change Champion competition. I'll leave that to the end. Concerns about partial project implementation and non-completion and sustainability of projects. There's also questions about what will happen when money runs out, when the project is finished. So the sustainability program I just spoke about, and continuous discussions about handover to the business. That's how we're addressing that. Then there's concerns about non-engagement of the communities. There's a social specialist in place to engage the communities, and messages will also be provided which can be tweaked for leadership, for the change agents to share with persons from the communities and with the wider staff members, so that people know what to say when the community, persons from the community might ask the questions. I don't have it on here, but the elephant in the room, there are some basic operational issues, and I call them legacy issues. I don't have it in the presentation here because these are things that we would have shared. The persons would have been talking about the things in the facility that need fixing. Whether it's a cupboard need for fix, the bathroom, absence of tools, etc. That you may be struggling with, training that you request that you don't necessarily go ahead with. All of these things we have packaged and shared, with management. We have escalated them because that is outside of our remit as a project, right? But certainly it is as part of the people-centered implementation approach, whether it's in or out of the project, once it's a personal concern that could stand in the way of the buy-in of the program, we have made sure that we ask the questions about that, and we have gathered that information and we have shared it with management. So some of your concerns that you think may not be going anywhere, management is aware of them. And like I said, there's a season for sowing and there's a season for reaping, but you don't never do both at the same time. So we need to trust that the fact that these issues have been escalated, that work is underway, right, Mr. Campbell? Work is underway to address them. Seeds are being sown to address them. And I would have spoken about very early the partnership that we are establishing with the IDB and the EU and the other international agencies to gather, investment so that we can address some of those additional concerns. And I remember something that Dr. Tufton said when he just came on as a minister. He went searching for money, right? There were so many issues. Lack of facilities, lack of infrastructure, rooms overrun with paper, affecting the operational, the safety and health of people, and he went searching for money. Who would have known that he was searching for money, right? And he was able to attract 148 million, some of it from the government itself, 148 million US dollars in investment that is being invested right now. So trust that right now, with all the gaps that are still there, probably Dr. Tufton or the team, the PS, and additional team members are out there searching for resources that can help to close those gaps. We have to trust the process, and we too have to step up, because together we can indeed transform the healthcare for a better future, and we can indeed grow from it, right? So how do we do this? We have to embrace the change and own the opportunities. I would have presented several opportunities before, and this is just scratching the surface. We can have multiple discussions, deeper discussions about how these opportunities really work and how many additional opportunities that you can take advantage of. But it's for you to wrap your mind around. In the challenge, there's opportunities. In this program, there are so many opportunities, but I can indeed grow. Commit to sowing the seeds for the better future. If you have a concern, believe me, there's a solution. If you channel your mind in that direction, I remember when I, just started out in corporate, I would just sit down, look around the company. That's how I elevated in corporate. And I would just write a random paper. I'm telling you, just write a random paper about how to solve a problem, even outside of my school, just because it's a problem. Right? The solutions man will always elevate, will always be above the person with the complaint. And I'm not saying that if you have a challenge, you mustn't talk about it, right? But the solution man, and I speak from experience, the person that's going to sit down and come up with a solution and come up with a strategy is going to rise above anybody in an organization. Your management will love you and you will gain access to greater opportunities for growth. You try it and you see, right? Tell us if there. Right. That sounds good. 2 changes. I should have 20. Tell us if there is a better way. We need to make suggestions and share our ideas. Participate actively in the change agent group. I see 2 change agents. Beautiful. We should have more. So let's see more persons stepping up to be a part of the movement for change and the movement to take this organization and yourself forward. Share presentations and materials with your team. So all of what I'm sharing here, we're gonna be if you don't get it, blame Mr. Campbell. No, so great. Woo! Beautiful. Ensure your region is always represented at meetings and engagements. Communicate your issues to your project liaison and your change specialists and your change network. Take the surveys. I can't emphasize this enough. The question that was asked before about, being demotivated, etc. Share your demotivation and your issue. If you're not coming with a solution and you want to share the issue, share it where it counts. When I send out a survey and people don't take the survey, how am I going to help you if I don't know what is happening? So if once you get a survey, guys, participate in the survey. Most of these surveys don't have more than 20 questions. My surveys don't have more than 15 questions and they're very short. But I'm just speaking generally about surveys. Take the surveys because that is where the information will help us or whoever the other team lead may be to come up with the solutions, to share the information where it counts so that it can be addressed. It don't make sense you have a challenge and you wrap up and you sit on one side and you talk about it, and when you get the opportunity to share it where it can make a difference, you don't participate in the survey. That just don't make any sense to me, right? And it should make sense to you going forward, right? So think solution and innovation. Invite the HSSP. Commendations to Mr. Campbell for inviting the HSSP, as he normally does, to attend the meetings and events and to make presentations like these. Ask for help and support and participate in the upcoming Change Champion competition. Now, I did mention that as part of the HSSP now, the stage that we have reached is that the regions need to own this initiative. Right? They need to drive the change. They need to come up with the different change management initiatives now. And so we're going to be launching this Change Champion competition, and region is going to compete against region. Let us see who the real champions of change will be in the health system sector. And I'm expecting great things from Sarah, right? We're going to be looking at strategies that you're going to be rolled out to collaborate, to own the change, to drive the adoption, right? To drive the commitment and to drive sustainability. So those are some of the things, but you'll get more information as you go along, closer to the time when we're launching this program, and we really look forward to some amazing things from the Southern Health Region, Southeast Regional Health Authority, St. Catherine. Thank you so much. Thank you so much for your attention. And if there are any questions, no questions. Right, and I'm seeing that we have 2 change agents, and that's amazing. Thank you so much for your time, and thanks for having me once again, Mr. Campbell. And I hope the presentation.
Okay, I know Mrs. Williams would have been very detailed, but do you have any further questions for Mrs. Williams? And just bear in mind, we have the full HR team here. We have Miss Golden, we have Miss Jessica, we have Miss Lewis. So all 3 institutions are here, and we have the CEOs here also. So now is a good time for you to shoot any question you may have. It may not be related to this presentation. We have Mr. Gordon, who I know in terms of challenges we are having with air condition, and he is working very hard to ensure that he can keep you cool throughout this summer. It's gonna be a tough one, but we are pushing very hard to ensure that we can bring up the ACs that are down. So do you have any further questions for us? No. What we will try to do for our next meeting, we will drill down more in terms of exact positions that will become available. The 3 health centers, we should have them on board, I think, by about May, June next year. We should have Spanish Town Hospital expansion within another 2 years or less. So it's exciting time for St. Catherine, and how you prepare now to take up those opportunities will say a whole lot. I mean, the time is now for you to prepare to take these opportunities that will come your way. Any further question? Guess I know everybody received their pay. You have all received our pay?
Yes, Mr. Campbell.
Okay.
It has been dispersed.
Okay, we are happy. We are happy, extremely happy.
When you come to my HR plus, Mr. Campbell, you get something.
I spoke about the I don't know if they
This is a new business.
No, long time.
Okay. All right, so we are giving you one last opportunity.
Who is next?
I hear that you don't have the question. So with that said, I know today is Friday. It is left for me now to wish you and the family a happy weekend. Next weekend is when we will be having holidays. So, exciting time for you all to recharge. And in all you do, remember, stay close to the family. Have a great weekend, and we will catch you again in another 2 months when we will have another of this session. Thanks all.
Bye, everybody.
Today, now we all about extra hours work.
Because you guys are advocating.
Close it, just close it.
No, I'm going to be here.
Yeah, try to find your register.
With extra hours work. We are seeing it. Yes.
So, and that is where communication, advanced communication stuff is.
Can close it?
Thank you.
Because we did have a direct deal. But in the restrictions, just like with this meeting, we had a meeting with them there. And then we went through.
You know what's
It's